Welcome back. You're watching us here on Halftime Report. Let's also take a look at another CNBC-TV18 exclusive. This one comes in from the sidelines of the bioasia 2024 summit, where our colleague Ekta caught up with Sanjeev Panchal of AstraZeneca India, started by asking about their third quarter performance and, more importantly, the outlook going ahead.
I think we did a good growth of more than 18%, which is phenomenal, I would say. And of course, as you know, our strategy is to be pioneers in science and lead in specialist disease area and transform patient outcomes. We are moving towards more specialist type of portfolio in India, and there's transfer pricing also happening. But overall the growth is great, and our approvals have been significant across our therapy areas in oncology, in rare disease, in cardiovascular renal metabolism overall. So it's a good time to bring innovative medicines to India.
Okay. Well, any input cost pressures that you all are facing?
No, as I said, that it is more how are you transforming to a specialist disease organization, and there's transfer pricing thing there. But overall, I think it's very positive direction.
What's your portfolio like in India? How much of it is patented? How much of it is under price control?
Mostly we are transforming towards a specialist disease and towards the patented, and as I'm saying, that our aspiration is to bring innovative medicines to India as rapidly as possible. So we'll see a portfolio turning towards more patented and less towards the general size.
You're looking to divest, I think, one of your manufacturing facilities and probably get a contract manufacturer on board for that facility. Why is that?
Our aspiration is absolutely clear, so that we want to become a specialist disease area organization, and this comes from an aspiration to bring innovative medicines as fast as possible. It's in line with that strategy. The other part is that how do we bring this Make in India concept, and we believe that some of medicines can be made by contract manufacturing. So it's in line with that absolute strategy which we want to do as we go ahead.
How big is this unit? How much are you probably looking to probably garner in terms of sales?
So that we cannot talk about. So the search is on for a CMO, and once we get further, we'll let you know.
Okay. Well, you know, the possibility of shedding this manufacturing facility comes at a time where the likes of Novartis is also conducting a strategic review. So there are MNCs, pharmaceutical MNCs, which are looking to probably streamline operations in India, probably look at, reducing their operation costs as well. Is AstraZeneca looking to do that?
No, I think in fact we are strengthening our footprints in India. So if you see, AstraZeneca has more than 3,000 to 4,000 employees across different functions. So we are not only a commercial organization, we also have factory, which we just spoke about, and how are we using this at a CMO. But we also have R&D, we have SMM, which is clinical trials team. We have a big center of Global Innovation Technology Center, which houses more than 2,000 people in Chennai. And we have a footprints of bringing. So I think we are actually strengthening our footprints in India. And I'm really pleased to announce that it's not about bringing science, but also focus on sustainability. So we recently announced 64 million trees being planted to take care of the planet. And this is in India and for India. So nothing to do with commercial, but our footprints in India is actually increasing. So bringing science to patients is one part, but how do we really contribute to the healthy people, society, and the planet? And a sustainability agenda is very high for us.
But on a larger scale, for pharma MNCs, are they finding it more difficult to work in India, probably because of the patent regime, probably because of the large amount of distribution required?
I think I won't comment on other companies' strategy, but overall...
But the larger industry,
I think the overall idea is that how do we bring science and innovation to India as much as possible. That's the key thing, and everybody will have their different approach. But as you can see in today's announcement as well, from different companies, we are really seeing in different form and shape, strengthening our presence in India. That's what I would say.
Your promoter, I think, holds around 75% stake. Any plans in terms of probably a strategic review there, looking to maybe shed off assets?
As I said, that we continue to bring innovative science in India. That's the major focus of us as an AstraZeneca in India.
Okay, and the larger picture would be bringing an innovative pipeline in India, probably staying away from the genericized drugs. Is that how we should look at it?
I think the way we have to look at is how do we bring access and equitable access of our medications faster into India. That's the major objective. As I mentioned again, I would say that we want to be pioneers in science, lead in specialist disease area where we believe that we can bring innovation faster and transform patient outcome. So when we do that, we have to ensure that our patients in India can get access to those innovative medicines which are being launched in the world as soon as possible. I think that's the key thing to this. That's one. Second thing is we're also looking at how do we bring prevention as a part of our strategy. So the partnerships which we are doing. So for example, our aspiration lung cancer is to eliminate lung cancer as a cause of death. Now we can't do that alone. We have to partner. So we partnered with Karnataka government, Ministry of Health, Goa government on the Ministry of Health. So we are doing those things. So one is bringing innovative medicines. At the same time, how do we bring early diagnosis to reduce the burden of the disease in the whole system? So that's what we are focused on.
All right, that's about AstraZeneca. Meanwhile, delivery